Hi, welcome to Straight Talk. I want to welcome all of our new viewers, our new cities, and hope that you enjoy the show. We try to talk about a lot of topics, but certainly this past year, we've been talking about the opiate epidemic facing this entire nation. You know, we expect this year to lose 66,000 Americans to an overdose from an opiate. That's an unbelievable amount of people dying. Many of them are young. So today on Straight Talk, we have a very special show. We have a young woman who lost her son to an opiate overdose, and she's sharing not only her story, but she's giving back to try to help others. Tammy Lofink, welcome.
Hi, thank you.
Thank you so much for being here. I
Thanks
can't
for
thank you enough, and just feel so terrible of what happened to you losing your son, but also I'm so grateful for what you're doing to give back. So thanks for doing this.
Thank you.
We really appreciate it. Let's talk about your son.
Okay.
You know, Robert was 18
years old.
when he died.
At home.
Let's talk a little bit about him.
Well, he was your typical boy, liked to push the limits, live on the edge. Great big heart. Most of the teachers loved him. He just didn't fit into the typical school box. He didn't like to study. He was very smart. Probably in the end of elementary school, beginning of middle school, he started sneaking out of the house, experimenting with alcohol, marijuana. I wasn't one of those parents who said, not my kid. Right away, I got him into counseling. It just progressively got worse through middle school. And I was one of the parents who said, I'm never going to put my kids on medication. I'm not going to do that. It got so bad, I got to the point where I said, I'll do anything to help him. So we took him to top doctors in DC, had him, all the tests run on him. He was diagnosed with pretty severe ADHD. So we put him on medicine, and I thought, okay, you know, this is it, this is going to be good. I think that worked for one day. I saw him do homework one day. He took his ADHD medicine. We're like, wow, look, we even have a picture of him doing homework. It was such a big deal. And things just got progressively worse to the point where I was in the middle of the grocery store. I think he was 16 years old, and I got a call from one of his friends that he had just had a seizure. They were at a restaurant, and the rescue workers were there. So they took him to the hospital. I spent the whole next day trying to find him a rehab center to get him help. The insurance company said he didn't need it. And this went on several times where I would take him to the hospital. They would say that he had a lot of drugs in his system, but they weren't going to keep him. That was another incident where he was 17. So
he was moving up.
He was moving up very quickly,
but
I still didn't know.
And then you didn't, but he was doing something more serious than you even knew.
Yes, and I didn't know until
Right.
he died. I really didn't know the enormous devastation of what was going on. So when he was 17, he had come home one night, and it was clear that, he sat in front of me and he could barely talk. He was slurring his words, called 911, took him to the hospital. Doctor came out and said, your son has a ton of drugs in his system, opiates, benzo, just you name it. So the hospital wouldn't keep him. We couldn't get him into rehab till the next day. Again, the insurance companies were saying, we're not going to cover it because he doesn't need inpatient. I had letters from doctors, the school, his psychologist saying yes. And I even told them on the phone, I said, my son's going to die. And they're like, well, we believe he doesn't need inpatient. So we paid for it, and we sent him to a place in Alexandria. Then we didn't have all the resources that we have now. And he went for 30 days. He came out, and I thought, well, we've done it.
He's cured.
He's cured. This is great. He graduated from high school, and he was doing really well. He had a job. He had signed up for a college class. At the same time, we were taking care of my father, who was diagnosed with stage 4 cancer. So there was a lot going on at the home. And my father died. And Robert, again, he seemed to be doing okay. And then 9 months later, I was making lunch in the kitchen. It was a beautiful Sunday morning, September 14th, 2014. Standing in the kitchen making lunch with my daughter, and my son's girlfriend came over. And she said, I'm going to go wake up Rob. And within seconds, I heard a scream, and I knew something was up. So I ran up the stairs, and he was lying in his bed. Thank God he was facing the window, so I didn't see his face, but he was in the fetal position, and I knew. There was so much commotion. My daughter, who was in 10th grade, was in the room screaming. His girlfriend was screaming. They were calling for my husband, who was in the other room. And I just had this overwhelming urge and need to get out of the house. I called 911 and ran out of the house. My husband went in and pulled him off the bed. There was blood and vomit everywhere. Gave him CPR, knowing that if he continued CPR, the responders would have to at least try, but it was too late.
It was too late.
So, yeah.
So he died in his sleep.
I think he died that morning. I was talking to my daughter in her room, and I heard this snoring sound coming from my son's room, but he snored all the time, and I had a thought for a second of, you know, maybe I should go in and check, and then I thought, no, he snores all the time. And that was him dying. So
he ended up with opiates, heroin?
Opiates, he had, I think, Xanax. I think there was cough syrup. I mean, you name it.
Anything he get his hands on.
Yeah.
Wow. And that was...
He had the pills and heroin.
That's unbelievable.
Yeah.
What a horrible...
Only 18 years old.
Horrible. What a waste.
Yeah.
That's something. So we hear about this now like we never heard before. I mean, even when this happened to your son, Robert, it wasn't as big as it is now.
It was just starting,
It was just beginning. I mean, now there's so many parents out there that are going through what you went through. How did you get through it?
I don't know. Well, I took off a lot for the first 8 months. I would get on planes and run away. I had a good friend. She lives in California, and when I just didn't want to be home, and I think that was my escape for a while, just to get out of the house. But also running, exercise. I just mentally, the day after he died, I had to get out there and run. And on the year anniversary of his death is when I started Rising Above Addiction. So I knew I had to do something not only to help myself heal, but keep him alive too. So
that's just survive.
Just
survive. You had other children.
Yes, I have a daughter. She's 18, and
So at that time, she was 14.
14, yeah.
So I mean, that's something for a family to have to go through.
Yeah.
And now we see families all over this country going through it.
Yes.
Every single day, dealing with this.
Yeah.
It's absolutely unbelievable. We're going to keep you here, if you don't mind. Then we want to talk about more of what you did and how you're feeling, but also about Rising Above Addiction, which is a group you started, and it's amazing. So thank you for sharing that with everyone. Really appreciate it. When we come back to Straight Talk, we're going to keep talking with Tammy Lofink about her own experience losing her son to heroin, but what she's doing now to try to help others. So stay with us. We're coming right back.
Why is Connor having trouble focusing in school?
Having trouble finding Connor's middle school? Would you like directions?
No, why is Connor having trouble focusing in school?
Finding lowest airfare to Istanbul.
No, I'm tired of fighting with him over homework.
Home, walk, restaurant. Need a review?
No, I need help. He's very smart, but his mind wanders. He's disorganized.
I think I understand.
Oh, good.
French fries. Finding best potatoes.
No!
Russet. Fingerling. Yukon Gold.
Why don't you understand me?
Sorry, I was trying to show how Connor feels every day. Frustrating, isn't it? Redirecting to understood.org.
For the 1 in 5 kids with learning and attention issues, this is what life can feel like. Explore understood.org, a free online resource about learning and attention issues, designed to help your child thrive in school and in life. Understood.org, because understanding is everything.
So they say it's a man's world? Well, I don't see anybody's name on it. While they were out doing their thing, we slowly changed all that. He changed all that. Today, women can do anything men can do. And there's one thing we're even better at.
Hi, welcome back to Straight Talk. We're talking with Tammy Lofink, who lost her son to an opiate heroin overdose when he was 18 years old. And it's a powerful story. And Tammy, I'm so glad that you're here and,
Thank you.
and being able to tell this story. Before we talk about the group that you started, what would you say to other parents that are going through this? I mean, you found a way to survive through it, and
Yes.
you're a runner, and you started a group, and you had good friends. What do you tell people? I'm sure everyone
People who
asks you
have
all the
lost.
time, what do I do? How do I handle this?
I always tell parents who have just lost a child that the biggest advice is when you have those dark moments. I mean, there were times that were so dark that you didn't want to go on, you didn't think you would survive, but you would get through that night. And I remember waking up after one of those nights saying, okay, I did it, and I feel a little better. So the next time that wave comes and hits you, you have to remember back to that time, okay, I felt like this before, I can get through it. And as time goes on, especially if you have other children, there's something to live for, and you can't take this tragedy and just give up, especially when you have other people that love you, and you can use it as a platform to help others who are going through the same thing. I mean, it's not easy.
Yeah.
I mean, you lose a part of yourself. And I always say I want to be with him as much as I want to be here with my daughter, but I know he wouldn't want me to give up.
Well, you certainly haven't given up.
No, and you just have to keep putting
Yeah,
one foot in front of it. You just kind of go into autopilot until you're not in autopilot.
Right. Just kind of work through it. Yeah, it's amazing. What you do is amazing. But now you've even gone above and beyond, because you've started several groups to help people. So talk about rising above addiction, and you also have a recovery house. I mean, that's amazing that you got into this like this.
It's organically grown. I can't believe it when I look back
Yeah.
and say, wow, if you would have told me this was going to be my life. My son used to go to therapy, and he was a big jokester, and he would go into his therapist and say, my mom, that woman, meaning me, has got to get a job. She is up my ass all the time. So I went to Kohl's and filled out an application for her to get a job. And he said, she's always
Doing
checking on
something.
me. So I say now he's got me. He's got me a couple jobs. So on the year anniversary of his death, a friend and I started Rising Above Addiction. We are a community partner with the Carroll County State's Attorney's Office, and we help people get into treatment. For the beginning, we would help a lot of people get into detox before it was required to be covered. Now that it is covered, I help a lot of people with getting their first couple weeks of rent for sober living. And I help families like somebody called me last night, a mom whose son is struggling, and I help navigate families and help them get to where they need to go and the people they need to talk to. And we do fundraisers. We do a skydive fundraiser in September every year. We had 120 people sign up to jump in September. We do a 5-mile run each year in June, and we're adding a golf tournament this year, which will be October 5th. So that we're
Just to raise money.
Yes.
Keep raising funds to help people
Yes.
who can't afford
and
to
I
get
and
help.
I wanted to do it in a fun way. I didn't want this to be a feel sorry for me, depressing, raising money. I wanted people to be able to do stuff that was healthy, like running. I used to avoid travel, so I decided I was going to jump out of a plane to kick off Rising Above Addiction. I know how hard it is for young adults to stay clean, so I thought, what can I do? So and it brings the whole community, not only the recovery community, but everybody else, to do some healthy things. They can, check something off of their bucket list. And then in June of this year, or last year now, opened a girls' sober home in Westminster called Reclaiming My Life, which is named after my son, using his initials, the RML. So we have about 8 girls, and that's running very smoothly, and it's really great to be able to provide these girls with a safe environment to help them on their road to recovery.
So you're kind of now part of the solution.
I hope
Really.
so, yes. Rob
Rob
has saved a lot.
I think it's safe to say that what you're doing is pretty amazing work.
Oh, thank you.
Because I would imagine with the numbers continually growing of impact on families, they don't know who to call.
Right.
They go online or they don't know, but to be able to speak to you, someone who's been through it,
Right.
can give them some really good advice. We had groups like Mothers Against Drunk Driving,
Right.
which was a model of victims.
Yes.
And what's happening now with the opiate epidemic seems to be the same thing. But what you did in Westminster, Maryland, can be done in Chicago, Illinois, can be
Yes.
done in any city who's watching this. So it's happening in every community.
Yeah.
What would you say, again, it seems like you did as much as you could. You tried to get them help over and over and over.
Yeah.
And, you did everything you could. But you still tried to get them help. And that's
I
still
did.
number one, right?
Mm-hmm. But I didn't know. I didn't
Yeah.
have the education that I have now. And he was very convinced and,
Addicts.
very, very manipulative. I mean, he would come to me and say, how could you accuse me of the one
Right.
thing, I'm working so hard. And I would walk away and go, I'm such a bad mom. Of course he's not using. Or when the morphine vial of my dad for his cancer went missing, how could I accuse my son? Because my son would never do that. I didn't understand that, of course, Robert in his right mind would never take medicine from his dying grandfather. But Robert the addict was desperate, and it wasn't that simple, and it wasn't that rational.
So
That
you
was
were
really
you were pretty
hard.
naive at that point.
I was pretty naive.
Yeah. So if you were telling other parents, you would say, get educated.
Yes, and your gut, that's my biggest thing.
Yeah.
My gut, I had warning signs, and all those times when I would accuse him or go to him, and he would convince me not. I always tell parents, if your gut is saying something's wrong, something's wrong. And they will convince you nothing's wrong.
Yeah, they're the best.
They are the smartest. I mean, Rob was so smart.
Yeah, because they tell you what you want to hear,
Yeah.
and that's part of it.
And you want to believe your
Yeah,
child.
of course, of course, of course. So follow your gut,
Yes.
get educated.
Reach
Take
out
action,
to your
yeah.
community to get help. I didn't know where to go. I was calling centers in other states. I didn't know we had resources right in the county, and we didn't have as much then as we do now. But we put together a community forum with Maryland Addiction Recovery Center, where we brought people out and we gave them information and tools and resources. It's great to have what we have now.
Yeah. And that's important, and we're going to
Yes.
talk about that in a minute, about resources. So hang in there.
Thank
Another
you.
segment. I really appreciate you being here.
Thank you.
This is very important information. Important. When we come back to Straight Talk, we are going to talk about drug treatment, give you some tips on what to look for in programs and what to do to help get the loved one you're concerned about the help they need. So stay with us. We're coming right back to Straight Talk.
Kids will spend 15 minutes watching online videos like this one.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes twice a day. They have the time.
Most party fouls are pretty dumb. But if you decide to drink and drive underage, you could lose your license and your freedom. Underage drinking and driving. The ultimate party foul.
There's one thing you can never have sex without.
It's not something you buy.
Or something you take.
In fact, there's only one way to get it.
It has to be given to you, freely.
It's consent.
Because sex without it isn't sex.
It's rape. Consent.
If you don't get it, you don't get it. It's on us to stop sexual assault.
Learn how and take the pledge at itsonus.org.
Hi, welcome back to Straight Talk. We've been talking about heroin addiction, overdose. We're talking with Tammy Lofink, who lost her son to a heroin overdose. And joining us in the discussion is Zach Snitzer, who is a co-owner of the Maryland Addiction Recovery Center, a treatment expert, I consider, you know.
Okay.
That's the role you're playing
I'll
today.
play that role today, yeah.
But anyway, thanks for joining us, Zach. You know Tammy, you know her story, you've heard what she has to say. You deal with this every day. You get the phone calls from parents every single day. It seems to be getting worse, not better.
It is.
Give me your assessment of this heroin.
There's numerous studies, there are numerous media reports and news stories that come out that it's not just an opioid epidemic, it's an addiction epidemic in the country, but it is getting worse, and there's a number of reasons. But it's unfortunate to say that stories, we hear this from parents regularly, like stories like Tammy's are not uncommon, and they are increasing. And the sad part is that in terms of getting people that are suffering from addiction the help that they need, it's something that we need to, as a treatment community and as a society as a whole, involve the family more, because the family is obviously affected and the family doesn't know where to turn. And the statistics is that you are more likely to have a loved one overdose in your house than you are on the street or somewhere else. So it is more on the professionals, the treatment community, to outreach families and educate them about addiction as a whole. Not just treatment, but about addiction, about the warning signs, about what to do to find resources, about where to turn. Because, in these situations, parents, your child comes to you and says, you know what, I have a problem, I'm addicted to heroin, or they get caught or whatever it is. And then mom, dad, spouse, sibling, whoever it is, they say, now what do we do? And I don't think as a society, we're doing enough to educate them about where to turn. If you have a medical condition, if you have cancer, you have heart disease, you go to your doctor. Right. Most primary care physicians don't have the first clue where to turn.
And even if they go to an emergency room,
you're turned away.
Right.
You're turned away. They might look them over and say, oh, he looks okay.
They'll do what they
See
can.
you later.
Right.
But they don't have the resources there either, unfortunately. Yeah. So, we hear it regularly, and I know Tammy hears it also, is that...
But it is a specialized treatment. Like you say, if this was any other illness, we would treat it like that illness needs to be treated.
Right.
Addiction is an illness that needs a special treatment, but we don't seem to have enough.
We need more resources, and we need more quality resources, and we need more long-term resources, because, and I know Tammy mentioned it earlier, is that families are in crisis, and they want to help their loved one, and their loved one is saying, I want help. And then, as a society, for years, it's been this idea of sending them to a 30-day treatment facility, or just getting them detoxed and medically stabilized, and now they're okay. Right. And the truth is that addiction is a chronic progressive illness that is fatal if left untreated. And a chronic progressive illness requires long-term treatment. It's not just the drug abuse. It's the behaviors, it's the attitudes, it's the mental health, it's the psychiatric issues, it's the trauma, it's all this stuff that needs to be treated, and that takes a lot longer than 30 days.
So having a magic wand in your hand, both of you, what kind of treatment should we have in this country?
What we need is more access points in hospitals and professionals and more treatment centers. And it needs to be a full continuum of care, a full continuity of care in terms of very acute detox, stabilization, residential, remove them from their environment, get them stabilized, a long-term transitional model where they're in a stable environment and getting to deal with the underlying issues, the causes, the conditions, the core issues, again, the relationships, being able to work on the family piece because the whole family is affected, and then slowly transitioning into a, whether it's a young adult college or a vocational or a workforce training and reentry. So they're able to start living their lives and transitioning back to being, a healthy member of society, a person that is in recovery while still in a supportive clinical environment, and transition them, in a year's time.
So you're looking at a year or longer. And Tammy, you talked about calling your insurance company.
And they are
they said-
experts in my family to know what I need. It's incredible.
And they wouldn't cover.
No.
And that's a big problem because you run a treatment center. I bet you get that every day.
Regularly, and part of that is, the ACA was created parity, and there wasn't a lot of enforcement of it. We run into it regularly. There are good insurance companies that understand and support this. I know, Blue Cross Blue Shield of Maryland is now dealing in terms of some outpatient levels where they're willing to do long-term treatment, but we need. Society is obviously affected, mom and dad are obviously affected, families are affected. We need to kind of have a voice and talk and say, we need to break that stigma and say mental health and addiction needs to be treated just like any other medical condition.
I mean, if you've got an illness like diabetes, you got to deal with it forever. I mean, why are we, it makes sense. Listen, thanks both of you for what you do, Tammy, Rising Above Addiction, can people call you from all over
Yes.
to get advice?
They can go to our website at risingaboveaddiction.com.
Yeah, we've got it up there right now.
And there's a phone number on there. Anytime
great.
they need help, they can give us a
And
call.
Zach, Maryland Addiction Recovery Center, you're willing to talk to anybody?
Yeah, we talk to everyone throughout the country, and it's not just for treatment that we can provide, but finding them treatment in their local communities if it's not in Maryland. And we do that all the time.
Great.
So.
Well, you do great work.
He helped a family member of mine who lives in Ohio. So
that's great. I mean, great work. Great work. And Tammy, again, thank you so much for sharing your story.
Well,
it's so important that people hear it from someone who's been there, so they understand they're not alone and that there is help. So thank you. Thanks both of you for being on the show.
Thank you.
Thanks, Mike.
Today on Straight Talk, we talked about the #1 problem in this country, and it's the heroin opiate epidemic. 66,000 people might be dying this year. You can do something about it. If you or someone you care about has a problem with alcohol or drugs, get help. Make that phone call. I want to thank our guests. Thank you for watching Straight Talk. We'll see you next time.